So I believe I started coming here after the new year. It's been like 8 months. And I started coming here because my son got a free clinic pass that he gave to me for Christmas. So anyway, so I've been coming here for about 8 months or so.
Perfect.
Yeah.
And depending on your comfortability, you can choose how much you want to share, but what were some of the concerns you were hoping to treat at the clinic?
Yeah, so first of all, I think coming to acupuncture just to relieve stress and anxiety, and it's very relaxing. But more specifically, I also have Parkinson's disease, and with that, my balance is compromised, I guess. And so I've had most of my treatments have involved some sort of balance kind of extra or treatment to help with that. And then also I'm perimenopausal, and so I was having hot flashes, especially at night. Well, I guess all the time. And so we often treated that. Sometimes we did treat a little bit of pain. I actually dropped, this is kind of weird, but I dropped a coffee mug on my foot and 6 months ago, and it wasn't healing, so we also treated that. It's a variety of treatments that you can have in one sitting.
So then I guess kind of going along the veins of that, have you received other forms of treatment for any of your concerns?
Oh yeah. So, and I think that's why it's so, well, for me, at least have a combination of Western and Eastern medications. So for instance, for my Parkinson's, I have had brain surgery, which actually made the Parkinson's better, but made my balance worse, which is kind of par for the course. And then I also take medications for my Parkinson's disease. And then with the menopause, I actually just started taking some over-the-counter medications, as well as seeing my OBGYN to help treat some symptoms. So I guess I've always been a combination of Western and Eastern medicine. So, and then also I have gotten physical therapy for the toe and for my balance and that kind of stuff. So I use it in combination with some other treatments.
Amazing. So from what I understand, these two kind of treatment styles are working in tandem to help you reach your goals.
Yes.
Amazing. And so how do you feel acupuncture kind of works together with Western medicine? How does it enhance those treatments?
Well, first of all, I have, and I wouldn't go to any Western doctor that would say, oh, it's a bunch of hooey, or, it's like not gonna, would be so arrogant to think that all these treatments in combination don't help each other. And they're not working against each other, they're working with each other. So I guess for me, it's also as simple as like just going outside for a walk, So I think that for me, hitting especially the Parkinson's, which is, a real challenge, or can be, with all of the things available to me is kind of the best. I can't imagine just doing one or just doing the other. Okay.
And then next, how have your experiences been at the clinic? What are some of your favorite parts of coming?
Oh, well, I love coming here. First of all, because it's like and it's maybe somebody might have the notion that, oh, you're not going to get the same therapist or something like that. And I have had a variety of therapists, although it's maybe been limited to 3 or 4, and I've definitely gotten to know them, both personally and professionally. And so it's, and I'm kind of sad because some of them are going to be graduating. I guess that's the one, kind of thing that makes me a little bit sad. But first of all, everybody from the students to the professors have treated me with utmost respect and professionalism, and it's just a warm, inviting experience, I guess. So yeah.
I'm so glad you feel this way.
Yeah.
I know our students and, of course, professors, they put a lot of care into both honing in their own practice and, of course, helping patients, so I'm glad.
Yeah.
And then next is kind of what is the result of your treatment? Of course, certain things will never be fully alleviated, but kind of what is the current result of the treatment?
Yeah, so I think well, first of all, I've had a miracle happen with my hot flashes or my night sweats. I do not get them anymore, and I think it's a combination of both going on hormonal therapy and then over the counter, and also the acupuncture that I'm receiving. But it was not debilitating, but it was definitely distracting. So I have not had anything in like 6 weeks or 8 weeks. So that's a big deal. In terms of my balance, well, I guess Parkinson's is it's a progressive disease. But I think coming here, and it definitely has not made anything worse, I guess is what I'm saying. And I'm going to keep fighting this disease and through acupuncture and walking and exercise, and also with my brain stimulation and Western meds. So yeah.
Perfect. Thank you so much. And lastly, a very simple question.
Yeah.
Will you keep coming here?
Yes, I will. I will, for sure. And I also wanted to say that for me, because I'm on a fixed income, there is the aspect of having it be affordable, and then also I can come on a more regular basis. So yeah, but I don't know if I'll ever go to a regular acupuncture. Never say never, but anyway, I do plan on still coming to the clinic. Yeah.
I'm so glad. And of course, I think one of the best things about our student clinic is that it does democratize
Yes.